Feeling that familiar ache or pain again? Physical therapy could be your remedy, and direct access at St. Luke's University Health Network could be your answer. Take a look.
I was playing soccer for the Parkland High School JV team, and I was injured, and I ended up tearing my ACL and my meniscus, and I went into surgery. And after surgery, I had to go through physical therapy with St. Luke's to get my knee back to normal.
While I was waiting with my daughter going to physical therapy, I had been running for a couple years and experiencing some hip pain, which thought, hey, I'm here, there's a physical therapist, let me just, ask him his opinion. So he had me come in and make an appointment, and in his opinion, there might have been something wrong, so he referred me to the orthopedist, where then I had an MRI and ended up finding that I did in fact have a tear in my labrum, in my hip, which Dr. Gibson repaired with surgery.
I send all my patients for physical therapy after hip arthroscopy. It takes a long time for that to heal. A lot of people have a muscle soreness and just difficulty getting around because things are very irritable after surgery. So it's hard even just to walk short distances.
Many of St. Luke's therapists have direct access certification, which allows us to evaluate and treat patients without having first seen a physician. Well, it benefits the patient because it cuts down on time. So if a patient gets injured, sometimes it does take a while for them to get in to see a doctor. They can come to the local therapy location. They can get evaluated by a direct access therapist, and that therapist can assist them with getting to the person that might help them out the quickest, whether that be the therapist or a specialist.
I feel I really benefited from the collaborative process at St. Luke's. They all helped me to reach my goal, my full potential of running the half marathon, which I couldn't believe, first of all, that I was running the half marathon that quickly after surgery. And I just kept thinking back where I was in January, starting physical therapy, and like, gosh, I'm never going to be able to do this. And here I am 15 weeks later doing this, thanks to Nick and thanks to Dr. Gibson.
Physical therapy has allowed me to run again and bend my knee and get my knee back to how it used to be. I learned from this experience that it's not always easy to just start doing something again. You need a lot of practice to get back to normal.
It was fantastic to get my life back because I am not a sit-around kind of person. So to be at home, sitting on the sofa, just, taking it easy was very hard for me to do. The St. Luke's team was just awesome in helping me get me back to where I needed to be. They understood my goals and were able to help to get me there very effectively.
Helping people get back to their normal activities, it's fulfilling. You've helped them. A lot of people have, they have jobs that require to be at their job. If they're parents, they have to drive their kids around. If they're kids and they want to get back to something that interests them, like a sport or an activity that they're involved in with school, it's important to them. So you facilitate them getting back at a quicker pace than they would if they did not receive therapy.
When someone goes to physical therapy, I think at a minimum what you get out of it is kind of a thorough evaluation. The physical therapist will check all of your joints, they'll check muscles and tendons and see what's tight and what's weak. It's something where you need that specialized knowledge, and I think a physical therapist brings that to the table. And even, no matter how physical your job, there are things that just aren't common knowledge that a physical therapy can give you.